Welcome back viewers. This is the part 2 of the video series of the human skeletal system. In the first part of this series, I have discussed about upper limb and shoulder girdle. In this part, that is part 2 of the 5-part video series, I am going to discuss and demonstrate the bones of thoracic cage, parts of scapula and clavicle, except vertebra, which is discussed in part 4 of this video series. First, I will start with sternum, which is a midline structure. As you can appreciate, this is a flat bone forming the anterior median part of the thoracic skeleton. Now you can visualize the uppermost part of the sternum called manubrium, which consists of a clavicular notch for first costal cartilage, and suprasternal notch or jugular notch, as you can appreciate here. Manubrium makes an angle with the body of the sternum called the sternal angle of Lewis. Moving downwards, there is body of the sternum, which is the middle part of the sternum. It is longer, narrower and thinner than manubrium. Body of the sternum bears notches for 2nd, 3rd, 4th, 5th, 6th and 7th costal cartilage. Moving further downwards, there is the lowermost part of the sternum called the Refored Process. It is the smallest part of the sternum. It varies greatly in shape and is bifid or perforated. It lies in the floor of the epigastric fossa. Next, I will talk about ribs. There are 12 ribs on each side as labeled in the video, forming the major part of the thoracic skeleton with their respective costal cartilage, and the gap between them is called costal spaces. The ribs are placed obliquely, the upper ribs being less oblique than the lower, and their length increases from the 1st to the 7th ribs and then gradually decreases from 8th to 12th ribs. The ribs are classified based on morphological features of ribs, that is, typical and atypical ribs. The first, second and the last 3 ribs have specific features and are atypical ribs. The 3rd to 9th ribs are typical ribs. I am going to discuss about typical and atypical ribs as we go through the video. Now we will talk about the features of typical ribs. You can see here the body or shaft of the rib is flattened and has 2 surfaces, outer and inner, and 2 borders, upper and lower. Now you can see the angle of the rib. You can appreciate tubercle, which is placed on the outer surface of the rib at the junction of the neck and body. Its medial part is articular and forms costo-transverse joint with the transverse process of the corresponding vertebra. The lateral part is a non-articular surface. Next, we can see neck of rib, which lies in front of the transverse process of its own vertebra. Then comes head of the ribs, which has 2 facets that are separated by a crest. The lower larger facet articulates with the body of the numerically corresponding vertebrae, while the upper smaller facet articulates with the next higher vertebrae. Now I am focusing on features of atypical ribs, which include 1st, 2nd, 10th, 11th and 12th ribs. You can see this first rib, which is the shortest, broadest and most curved rib. It consists of an anterior end, posterior end and shaft. Anterior end is continuous with the first costal cartilage. Posterior end comprises head, neck and tubercle. The head articulates with the body of the first thoracic vertebrae. The tubercle articulates with the transverse process of first thoracic vertebrae, and shaft or body with 2 surfaces, upper and lower, and 2 borders, outer and inner. Now we can appreciate second rib, which is twice the length of the first rib. The shaft has no twist. Near its middle, it is marked by a large, rough tubercle, which is unique feature of the second rib. Next, we can move on to the 10th rib, which is similar to typical ribs but is shorter and has a single facet on the head. Now we can see the 11th and 12th ribs, which are known as floating ribs. They are short, the head and tubercles are absent. Here you can see the labeling of the 10 costal cartilages. Now you can appreciate that the costal cartilage of the 10th, 9th and 8th ribs joins the costal cartilage of 7th rib, which ultimately directly joins the sternum. The costal cartilage of 6th, 5th, 4th, 3rd, 2nd and 1st ribs are seen here directly joining the sternum. Another classification of ribs are as true and false ribs based on the articulation with the sternum. The first 7 ribs, costal cartilage, attaches to the sternum directly and are called true ribs. The remaining 5 are false ribs. Now let's discuss some of the clinical aspects related to ribs. The weakest area of the rib is the angle of the rib, the commonest site of fracture. In rickets, there are prominent costochondral junctions in the thoracic cage called the rachitic rosary. Now we will talk about scapula. As you can see here, it is a flat bone placed on the posterolateral aspect of the thoracic cage. Moving laterally, there is the lateral border which is thick and at its upper end, infraglenoid tubercle is present. Then going medially, medial border is thin that extends from superior angle to inferior angle of the scapula. Scaphoid scapula is a developmental anomaly in which medial border is concave. Moving upwards along the medial border, there is spinous process, which is a triangular plate of bone. It divides the dorsal surface of the scapula into supraspinatus and infraspinatus fossa. Moving upwards and laterally along the spine, there is acromion process, which has a facet for clavicular attachment at acromial angle. Going upwards, there is superior border, which is shortest, and near to the root of the coracoid process, suprascapular notch is present. Then comes coracoid process, which is anteriorly present and articulates with clavicle and forms coracoclavicular joint. Now we move on to the next bone, that is clavicle. It is the only long bone which lies horizontally and is the first bone to start ossifying. First we start with the acromial end, which bears a facet that articulates with the acromion process of the scapula to form the acromioclavicular joint. Moving downwards, there is trapezoid line present on inferior surface of clavicle, which accommodates insertion of trapezius muscle. Next we can see conoid tubercle, which is an elevation present on the inferior surface of the clavicle, which gives attachment to the conoid part of the coracoclavicular joint. Moving medially and inferiorly, there is subclavian groove, which is present on the lateral end of the inferior surface. It gives attachment to subclavian muscle. Moving medially, there is sternal end, which articulates with the clavicular notch of the manubrium sterni to form the sternoclavicular joint. And inferior aspect of articular surface articulates with the first costal cartilage. Next we can appreciate shaft of clavicle, which is divided into lateral 1/3 and medial 2/3. The commonest site of fracture of clavicle is the middle of the bone, between sternum and acromioclavicular joint. It occurs in an outstretched hand. Features include swelling, tenderness, and increased pain when moving the shoulder. Treatment is through simple arm sling used to limit the shoulder movements and anti-analgesics for pain. Now let's come to the clinical anatomy related to scapula. Paralysis of the serratus anterior causes winging of the scapula. This completes the thoracic cage along with parts of scapula and clavicle. Thank you for watching this second part of this 5-part video series on human skeleton. In the next part, that is third part, we will talk about the bones of lower limbs. Thanks for watching. Do watch my other videos and please like, share and subscribe them.